Good afternoon, everyone. Good afternoon, and thank you everybody so much for coming today. I'm Dr. Rick Helmers, and I'm honored to be the Regional Vice President for the Mayo Clinic Health System here in Wisconsin. It's great to be with you to gather to celebrate the completion of this incredible new hospital. Isn't this impressive? There's 180 hospitals in Wisconsin, and before you stands the newest. What this hospital will be is this will be a place of hope, a place of healing, a place of new life and great joy. But it will also be a place where those facing serious healthcare challenges will have the peace of mind, knowing that they are in the hands of a caring, compassionate, talented team committed to putting the needs of the patient first by bringing to bear unparalleled expertise and innovation. But as much as today is a celebration of a new facility, it is also a celebration of the inspiring work of the staff here. In recent years, this team took on the complex challenges of a worldwide pandemic and then ramped up the planning for this new hospital while continuing to deliver world-class, award-winning care in a very busy medical and surgical practice. And even though I am new to this region, I am well aware of the enormous efforts of prior leaders here to get this new hospital from a vision to reality, and I feel very lucky to be part of this final phase. As you move about in this new space, you can literally feel our staff's commitment to this project, their patients, and to the community. And I know our patients and families will feel that as well. And the outcome of all this planning and hard work, a modern hospital that blends physical space and digital capabilities, offering an impressive spectrum of inpatient to intensive care, along with many innovative procedural and advanced diagnostic capabilities, wired with the latest technology and ready for technology that hasn't even been developed yet. All on the same campus where the very first hospital in western Wisconsin opened in 1888. And as someone who's had the great experience of being involved in several roles across Mayo Clinic, I feel I am really blessed to be here and help further the remarkable heritage begun by the Franciscan Sisters of Perpetual Adoration. This hospital sets a new standard for community health systems with digitally enabled space designed for convenience, safety, and quality now and in the future. Today's event certainly is a special occasion, not only here in the community and the region, but for all of Mayo Clinic. Mayo Clinic, the preeminent healthcare organization in the world, dedicated to advancing care through practice, education, and research. Within the global enterprise, the Mayo Clinic Health System is a network of community hospitals and critical access hospitals and specialty clinics throughout portions of Wisconsin and Minnesota. With us today are the leaders from across Mayo Clinic and across Mayo Clinic Health System. It's now my pleasure and honor to introduce the President and CEO of Mayo Clinic, Dr. Genrico Farrugia.
Well, Rick, Dr. Helmers, thank you. Thank you to Dr. Farkey, Chris Hassey, to Tanner Halls, Lisa Archer, and truly all of our Mayo Clinic Health System for making today's event possible. All right, we'll see how long this lasts. I started off by thanking everybody. I won't repeat all my thanks, but I'm certainly grateful to be joined by Mayor Reynolds today, Rosalind Cleveland, representing the Ho-Chunk Nation, and several state and local officials. We very much appreciate your support that enabled this to happen. I really also want to recognize Sister Sue, Sister Marlene, and all of the Franciscan Sisters of Perpetual Adoration you heard, who we are truly honored to carry on their legacy of care, and we are inspired by their spirit of generosity and service that we now continue. And I'm delighted to see here some of the sisters who serve and have served on the Mayo Clinic Health System Southwest Wisconsin Board of Directors, so many community board members, as well as several former Mayo Clinic Health System leaders. Thank you all for being here. We also have here some tremendous friends of Mayo Clinic and the Mayo Clinic Health System. Their commitment, their vision, and their stewardship enable us to transform healthcare for the people here in La Crosse and in the region. And thank you for your generosity. Finally, a special note of gratitude to the La Crosse community as well. You have collaborated with us, you've supported the hospital over the past 140 years. It is nice to be able to now dedicate this new hospital. Today marks not just a significant milestone for Mayo Clinic, for the Mayo Clinic Health System, and of course for La Crosse, but it also stands as a testament of a very different kind of community healthcare and the possibility of transforming our medical infrastructure nationwide. Many of our hospital buildings throughout the country are outdated, and they cannot effectively deliver the optimal digital and physical care that is today possible. With this project, as well as our prior expansion in Mankato, we are committed to leading the next generation of digital and physically enabled community care to patients, while at the same time also meeting the needs of healthcare staff and the whole community. So this new 96-bed hospital is a beacon of progress, bringing unparalleled care to the region and integrating new technologies among many design enhancements that are aimed at one thing, which is making sure we elevate the experience of both patients and staff. These advanced and adaptable care spaces, along with connected tools, will foster an even greater collaboration across our sites, including with Mayo Clinic in Rochester, and also across the three areas that contribute to our core mission, as you heard from Dr. Helmer's: practice, education, and research. Just going to make one highlight. We here have the most advanced of our imaging and diagnostic capabilities, including the only digital 6-ring PET-CT scanner in the region. This is important, will enable us to markedly reduce the radiation dose and examination time. And we also have larger patient rooms. We have this new connectivity to telemedicine technology with integrated digital tools that will display the care team information and also the care team details. So this digital and physical integration now equips our staff with the latest tools to cure, to connect, and to transform community healthcare and merge in and outpatient care into a seamless care experience for patients and their families. And despite the formidable challenges facing rural and community healthcare, our Mayo Clinic healthcare system is committed to transforming healthcare through our Bold Forward strategic plan, supporting when it is possible high-quality care close to home, and ensuring that more patients can lead longer and healthier lives. La Crosse and all of the Mayo Clinic Health System continue to exemplify Category of 1 community healthcare for patients in the area. So I'll end by saying thank you once again to everybody. Thank you to Mayo Clinic Health System, and thank you to the community for your leadership and dedication into turning a vision into reality. Thank you for providing hope and healing for the people in this region. Congratulations.
Thank you, Dr. Ferrugia. I also want to thank and welcome Mayo Clinic's Chief Administrative Officer, Christina Zorn, who is also with us today. As Dr. Ferrugia mentioned, we also have state and local elected officials with us, and we owe them a great deal of thanks for their support of this project. With us are State Senator Brad Pfaff, State Assembly Representatives Jill Billings, Steve Doyle, and Lauren Oldenburg. Thank you also for being here today. Also with us is La Crosse Mayor Mitch Reynolds, and he has a mayoral proclamation to share with us. Mayor Reynolds.
Thank you so much, Dr. Helmers, and it's such a pleasure to be here today. I'm so grateful that you invited me. I'm in awe. This is tremendous. What an incredible addition to our community. I was struck by just this morning, I realized that I can see the helicopter from my office. I didn't know that before. That's pretty incredible. I don't even know who the mayor was in 1888. I know for sure he could not see the helicopter from his office. So that is incredible. Just that is an incredible transformation. For those of you who remember the helicopter taking off and landing from the parking lot over there and, uprooting all sorts of neighborhood activities. At any rate, it's a pleasure. I'm really glad it's up there. Let's just put it that way. Again, a pleasure to be here. Dr. Helmer said this is a place of hope. This will be a place of hope. And it's more than that. And I do have a proclamation, but just a couple of words. It is more than a place of hope. It is also an expression of the dedication of Mayo to our community. And for that, I am grateful. It is an expression of the commitment to the health and well-being of the individuals, the people who live in our community, and for that I'm grateful. It is also an expression of belief in the neighborhoods that surround the Mayo, this hospital, and for that I am endlessly grateful. I am grateful for the partnership that we have had over the last 140 some years, whatever the actual number is, 141. We're in this together, and I thank you for continuing to be that partner for the city of La Crosse and this tremendous community. So, with that, a proclamation. Whereas medical care is foundational to a community's quality of life, and whereas the people of this community have benefited from exceptional medical care and quality of life since Western Wisconsin's first hospital was established by the Franciscan Sisters of Perpetual Adoration here in 1883, and whereas the hospital founded by the sisters has progressed to become a part of the Mayo Clinic Health System unparalleled in medical quality, research, and innovation, and whereas Mayo Clinic Health System has made a transformational commitment to La Crosse by establishing and today dedicating its new integrated state-of-the-art medical facility in the heart of the city. Now, therefore, I, Mitch Reynolds, Mayor of the City of La Crosse, do hereby proclaim this as Mayo Clinic Health System Day in the City of La Crosse, dated on this day, the 21st day of August, 2024. Thank you.
Thank you, Mayor Reynolds. We're very grateful for all your help and support and all the help from City Hall for this. Thank you for all your support. It's also my pleasure and honor to welcome the President of Mayo Clinic Health System, Dr. Pratibha Varki.
Thank you, Dr. Helmers. Welcome again, everyone, and thank you for joining us today. Crosse, my administrative partner, and I are thrilled to be here in this truly exciting occasion. Today marks the beginning of a new and exciting chapter in La Crosse. Our bold forward strategy is to establish Mayo Clinic Health System as a category of one in community and rural health nationally. Forward-looking healing spaces that reimagine care and are hopeful and inspiring for our patients and staff are a key priority in that strategy. Designed to provide a compassionate, patient-centered, holistic experience, this state-of-the-art facility blends advanced technology with holistic care. Sustainability was also a core principle in the hospital's design and construction. We have incorporated green building solutions such as energy-efficient systems and recycled materials, certainly surpassing national standards to significantly reduce our environmental impact. To realize this beautiful building, there are so many to thank who worked tirelessly together to create this legacy to serve the community. To Dr. Farrugia, Christina, and our Board of Trustees, thank you for your unwavering support of our staff and patients through historic capital investments in the health system communities that we serve. To our extraordinary physicians, nurses, clinicians, and staff, congratulations. We are so proud of you. Your dedication to quality and excellence has consistently placed us at the forefront of healthcare in Southwest Wisconsin. We are so proud of you, your accomplishments, your dedication, and hope that the new hospital will serve as a catalyst for even greater innovation and compassionate care. To the many hardworking leaders who have worked on this project, Dr. Rick Helmers, Tanner Holz, Lisa Archer, our CNO, thank you. Dr. Paul Mueller, Mike Morey, and Mary Jo Williamson early in the journey, our facilities colleagues, especially Karen, and to our community partners and benefactors, thank you. We extend our deepest gratitude for joining us on this remarkable journey. More than a century ago, the Franciscan Sisters of Perpetual Adoration laid the foundation for exceptional healthcare in La Crosse by establishing the St. Francis Hospital. Their legacy of compassion and healing inspires us to continue the tradition of making a profound impact on countless lives for the years to come. We are so grateful to the sisters and to our La Crosse community for the trust that you place in our care. We are so excited about the future of healthcare in La Crosse and the transformation of health and well-being that we will do together for our community. Thank you again. What a truly exciting day.
Thank you, Dr. Varghese. I also want to recognize the Mayo Clinic Health System leaders who are with us today. In addition to Dr. Varghese, we have the Chief Administrative Officer, Crosse, and the Chief Financial Officer, Jim Williams. I also want to acknowledge members of our Board of Directors of Mayo Clinic Health System in Southwest Wisconsin. And we have our administrative leaders and managers, and a special group of people that we call the launch team, who've been planning every element of our transition to the new hospital. Before we proceed, I want to invite all of you to stay after the ceremony. We'll have refreshments and tours of the new hospital. All of work will be completed in 1 month, so not everything is totally completed, but it'd be great to have a tour. Then later this afternoon, we'll be joined by more of our staff, and we'll unveil a special project we're calling the Faces Within Our Walls. Staff were invited to have their photos taken for collages that will appear throughout the new hospital and across our campus. Now it's time to introduce a person who spent a career inspiring not only his students, but our entire community. A distinguished professor at Viterbo University, founder of Viterbo's Master of Servant Leadership program, and a tremendous servant leader himself, Tom Thibodeau. Tom.
Thank you, Dr. Helmers. What a joy and a privilege it is to be here today to celebrate a sacred past and a hopeful future. I'm also a bit sad because my part-time job as sidewalk supervisor has come to an end. For the last 18 months, from my office on the Viterbo campus, I watched you prepare the site, build the crane. I watched you pour the forms where an army of cement trucks were lined up for days. I watched you hoist the walls and the windows into place. And I prayed when those gusts of wind would come up and that crane operator in a catbird seat guided it into place. I watched this all being done by people wearing hard hats and green shirts, carrying thermoses of coffee at 7 o'clock in the morning. And we celebrate all this good work, but especially the commitment of the Mayo healthcare system to build community which is institutionally and personally significant to all of us. Robert Greenleaf, the modern founder of servant leadership, wrote in 1970, "I believe that caring for persons, the more able and the less able serving each other, is what matters for a good society. Most caring was once person to person. Now much of it is mediated through institutions that are often large and impersonal. If a better society is to be built, one that is more just and loving and providing opportunity for people to grow, then the most effective and economical way, while being supportive of the social order, is to raise the performance of institutions as servants, led by people with a voluntary and regenerative force initiated within institutions by committed individuals. Thank you to the regenerative forces and committed individuals in the Mayo healthcare system who are faithful to the mission of serving our community and particularly this neighborhood. As a Franciscan Sister Perpetual Adoration who came and put down roots in our community in this neighborhood from the 1860s. The FSPA are spirit carriers whose service and leadership continue to nurture our spirits in commitment to a greater good. Institutions are the ways in which we lay hands on the world. Institutions organize our lives. Institutions are stewards of our culture. Institutions continue to gather us all for a good greater than ourselves. Thank you to the Mayo healthcare system for honoring our institutional memory and your commitment to creating institutional hope. Good work, hard work, noble work, sacred work. Thank you for your commitment to being good neighbors to those of us at Viterbo University. Thank you for providing space for the Cooley Recovery Center where healing and good coffee are available. Thank you for providing a space for a community resource officer who makes us all in the neighborhood feel safer. Thank you for providing counseling services for our young neighbors at the Boys and Girls Club. Thank you for providing a space for Viterbo nursing students and other students who are doing internships and those needing a good job in a world-class institution. Thank you for baking bread for our neighbors who are hungry for food and community. Thank you for providing meals for our elderly neighbors. Thank you for providing compassionate care every hour of every day in your emergency room. Thank you for your commitment to world-class medical research and medical care that is rooted in love. Service is love made visible. This new building is a visible sign of your love for us, your community, your neighbors. Love your neighbor as you love yourself. Thank you, Franciscan Sister Perpetual Adoration and the Mayo Healthcare family who have loved us for generations. Good work, hard work, noble work, sacred work, your work. Thank you. Thank you for doing it so well. Peace and all good.
Thank you, Tom. We appreciate you, and we are grateful to have you and Viterbo as such great neighbors, collaborators, and friends. As we prepare now for the blessing of the new hospital, I'd like to take us back to April 12, 2022 in the groundbreaking ceremony. The land where our campus sits is the indigenous land of the Ho-Chunk people, whose vibrant nation still thrives here to this day. As we began this project, the ground was blessed by Sister Eileen McKenzie, then president of the Franciscan Sisters of Perpetual Adoration, and Marlon White Eagle, then president of the Ho-Chunk Nation. As we think about those who are involved in this new hospital, we want to remember the words of President White Eagle, who said, Bless them as they take on this project, all those who have had a hand in it. Bless them in good things, good favor, good fortune, and good health. We are so pleased to report that this project was indeed completed safely with no injuries or mishaps. That's a tribute to the fine work and dedication of Knutson Construction, our general contractor, and the more than 50 firms that also participated in this project. We're grateful to all who helped build this hospital so smoothly and safely. And now for today's blessing, we turn to someone who's been part of our organization for many years. She is a past president of the Franciscan Sisters of Perpetual Adoration. During the 1980s and 90s, she served as what was known then as the St. Francis Medical Center Board of Trustees. Upon completion of her term, she joined our hospital's community board until she was invited back to the Board of Trustees for 3 more terms until 2012. To bless our new hospital, I'm honored to welcome back Sister Marlene Weisenbeck.
This blessing was written by Sister Celeste Day, who was originally intended to be here to share it with you, and she is unable to be here, so it's certainly my privilege. I invite you to extend your hand if you wish, and to join in the blessing of this house of healing as I pray. Building made of the materials of earth, we honor the work of those who planned for you and for all those who have crafted you so beautifully. We consecrate you for the work you were meant to give. We ask that each space within you be filled with the attitudes of compassion and kindness, with attention to good science and skills, with the revitalization of the human dignity of each person served and serving. We send the expectation for the gift of healing in whatever form is most fitting for all who come to you. And to the one who created us and that is all around us, we thank you, the one who has promised to hear us and tend to our needs. All this in your name, as is the source of all being, the Word made flesh, and the Spirit in our midst. So be it. And we say together, amen.
Thank you so much, Sister Marlene, for all you have done and continue to do for Mayo Clinic Health System here in La Crosse. Hello and good afternoon, everyone. We are getting to that moment. I'm Jennifer Livingston. I'm the Director of Community Engagement for Mayo Clinic Health System in Southwest Wisconsin. We are so honored to look around and see so many community partners and excited to see staff from all around the health system, all around the enterprise. And it's time for our ribbon cutting. I did a little research and learned that ceremonial ribbon cuttings are believed to have started in ancient Rome, where a ribbon or a streamer was used in a symbolic act to represent the connection between past and present, as well as the hope for a bright future. So that, I think you all will agree, certainly describes what is happening today. So we are asking all who have spoken already through this program today, as well as Christina Zorn, the Chief Administrative Officer for Mayo Clinic, Chris Hasse, our Chief Administrative Officer for Mayo Clinic Health System, Lisa Archer, Southwest Wisconsin's Chief Nursing Officer, Dr. Scott Acuno, Southwest Wisconsin's lead physician, our Regional Chair of Administration, Tanner Holst, our Regional Chair of Facilities, Karen Finneman Killinger, is supposed to be up here and in a chair. Chris Rubenzer, who is representing Knutson Construction and all of our construction workers, Sister Sue Ernster, the president of the Franciscan Sisters of Perpetual Adoration, and representing the Ho-Chunk Nation, Rosalind Cleveland. So if everyone can get in place and scissors ready, I think we should count everyone down from 3, 2, 1. I'm going to step out of the way first, though. It's official. We have a hospital, and you can continue to stand here. We'll take a few more pictures. I'm just going to say a few announcements. We do have food, beverages, tours available that we will begin as soon as several of the people that are out here are in their places for the tour. So give us about 5 minutes. We're going to have a new tour starting every 5 minutes. We're going to try and limit them to about 10 people per tour, so it gives you a chance to hear and see everything we would love to show off to you. And we're just so thankful to be at this place and proud to show it off to you. Thank you all for coming, and we invite you in.